Well, hi, everyone. Thanks so much for taking the time to attend this third quarter's Primero Data Challenge. I know we're a few minutes into the hour and really appreciate you all for coming on time. One of the things, this is really spearheaded by Robert, the Primero lead, and trying to and find a space where everyone can talk about data, how they're using data. And really, one of the things that we want to ensure is that you can all get to know each other in this space, because child protection is underfunded, and we're all trying to figure out how to best inform our programming. And that's really what we wanted to do in this space. So what I'd love, if you can, and if you can see the chat, if you could put in your name, your title, that would be great, just to have everyone introduce themselves to one another, and then we'll get started. I'll quickly share my screen and walk through what our plan is for the next couple hours. And let's make sure I can do this. Perfect. So this is our third quarter that we've done this, and we've had a few other presentations, and I'm going to pop into the chat our microsite, which has recordings from the other two quarter presentations. But in today's session, we're going to be talking to the Cambodia team, who are going to kick us off. They've put in a ton of investment and time and resources into building a national level reporting dashboard, and this is integrated with Primero. After that, we will be talking to the Jordan team. Abid is on the call, and he's going to be talking about these new enhanced reports that we have in Primero. And then we have Megan, who's joining us from International Rescue Committee. She is predominantly focused on the GBV IMS Plus, and really going to be focusing on the key point indicators, looking at how they're measuring outcome scales within their system. And this is completely different from anybody who's doing the CPIMS Plus. So really excited to showcase this for you. As we're going through, we are going to have different surveys and tools that I'll pop into the chat, but please ask any questions. We want to make sure that you're able to understand what the teams are doing, and we'll give space after every presentation to ask some questions as well. So with that, I'm just going to stop sharing and have Faneth take over the presentation, and then we'll get started.
Just so everybody knows, Jan, we are recording this session so that we can share it. I hope everybody's okay with that. Thank you.
Thanks, Rob.
Thanks, Jan. So, Suman, I would like to invite you to make the presentation, and then I will continue on the walkthrough slide.
Thank you, Paneth. Yeah, welcome all. I'll start with a bit of a context. I do a bit of a boring thing, but it's very useful and important. And Paneth will take us through the dashboard itself, which is a bit more interactive and a bit more fun. So just to start with, this was something we started like about 6 years ago, when we realized there was a big data need for programming, resource mobilization, and that there was data in Cambodia, but it was dispersed, and it was not really in one coordinated platform. Thank you, Paneth. Next slide. So we all came together, and it was very important that we wanted to have this kind of like child protection longer term focus than just investing in data itself. So what we came up with is, what do we really want child protection information management system to look like? And just to say, this doesn't refer to the Primero CPIMS module. This refers to the overall system. So if you see there, we're looking at 5 kinds of data structures where we derive data from. And then today's focus is going to be the 4th one, which is the case management and coverage. But just to say that we had a very long-term focus from the very beginning. We're looking at 2 kinds of data at that point. We wanted something that had a dashboard where all the data, critical data and child protection, were coming together for like national level planning, monitoring, and reporting. And then we wanted individual, what we call operational and agency level databases and information system, which would feed into the dashboard, but also would actually enable the programmers and people to actually do their job better. So then these two systems kind of interact, so adding value to each other, basically, ultimately leading to better programming. And to make that happen, so we developed a child protection monitoring framework, and this was kind of where all the different ministries came together, just because the data was scattered across different ministries. So having that buy-in and coming together was very important. And then just to basically start with, what do we want in child protection? How do we want to monitor it? And we started with indicators. So what are the main indicators and outcomes and results that we wanted? And we came up with 5 domains. And 50 indicators across them that we thought was important for child protection sector to know. And again, today case management falls under domain 4. So if you look at our timeline, we started with like very broad establishment of the target state, the system architecture, how do we want it to look like, then went into monitoring framework developed. And then actually after that, we went into Primero, and that's when we decided we wanted to have this operational database that I was talking to you about, information system. For that, we decided to use Primero. And then at the same time, in parallel, we're working on the dashboard. And then obviously Primero was then made interoperable with CPIMS, and that work was going on. And then the Primero itself, then we developed dashboard. So it was like all these things have been going on in parallel and like really evolving, and it's been very dynamic process. So it's been really interesting so far. And I'll talk more on how we're utilizing it. I'll let Paneth take us through the dashboard itself now. Over to you, Paneth.
Thanks so much, Suman. So, hi everyone, it's me again, Paneth from Cambodia. So, as Suman mentioned, we have been providing technical support to government to actually strengthen the utilization of Primero Data to inform the decision making. So, I will walk you through. One is the CPIMS dashboard, how we actually integrate Primero with the CPIMS dashboard. And secondly, I will also show you another dashboard that we provided support to government to develop. This is for tracking the case management progress, so it's more at the operational level. So I will show you how this dashboard look like, and I also will take you through the process that we have gone through in developing this 2 piece of work. So let me go through take you through the system directly. So if you can see here, this is the CPIMS dashboard. The full name is Child Protection Information Management System. So this is the introduction page. It has both Khmer and English. And as mentioned by Suman, we have 50 indicator defined in the 5 domains defined by the Child Protection Monitoring Framework. And in terms of the government actually provide the idea of this dashboard. Actually, the government actually share regularly the data and annually, specifically on this child protection indicator through two ways. One is the government focal point enter the data directly into the online platform, CPMA platform, and for another way is we actually develop the connection, or we call the integration between the existing IMS with the child protection with the CPIMS dashboard. So in our example, we actually developed the integration of Primero with the CPIMS dashboard that I will show you. So this is the Primero actually provide the data through this integration into 2 indicator, indicator 4.8 on the children recovery integration service, and 4.11a on the number of children receiving care management support through the Primero. So for our presentation, I would like to take you through the integration of the Primero with the CPMA dashboard. So in here, you go to domain 4, So you will go to, you can filter here on this dashboard. So for instance, I filter last year, and we go together to the indicator on the care management using Primero, which is 4.11a. So you can see here, this is the 4.11a, and you go into this indicator, you will see the number of children receive care management support using through the utilization of Primero care management system. So based on this indicator, I mean, based on the work of the Primero and CPMA integration, you actually can define what kind of specific data you want to visualize in the CPMS dashboard. So for instance, we show the number of total case, and you can also define also different type of data visualization in terms of chart, pie chart, map, or also trends, data trend. For instance, we also have data trend in a number of indicator as well, like I will show you later. So for this dashboard, we can also show the, you can see here the children with disability by age group and a different type of service and the protection concern. So that means you can also show the data by different type of desegregation. And I will also show you later on the Primero dashboard. So as mentioned, the Primero dashboard mainly, if you can see here, we have both one in English, mainly used by government caseworker, and also in Khmer and also in English. So in the dashboard here, you can see this is the technical support that UNICEF have provided to the government to actually to track the progress on care management through their monthly meeting with the government social worker. So in the meeting, we're looking at the overall progress of care management. If you can see here, there are actually 5 pages in the dashboard. 3 pages capture the general information of the case, and the last 2 pages capture the information more detail, go into more detail on the care management step and detail. And in this dashboard, we can apply different filter. We provide richer and easier to access the data. You can filter, for instance, here you can filter by province. For instance, a filter by TMJ, which is one of the 25 provinces in Cambodia, and you can also filter by district. So it really gives easy access for government, and we can they can use it to track where they are now in terms of different administrative level in terms of care management. And second page, you can see the intake by years and months, and also at risk level and different protection concern as well. So really, it's very good and been very useful information for the government, which they need to actually support the care worker to actually improve the quality of care management. So you can see here the data is showing how many cases by province, 25 province in Cambodia. You can see which province have the most case. You can also filter by date. And for each province, there are also data showing data by district level. We go one level down to after the province. So for instance, in Battambang, there are different districts, and the care manager can supervise provide the supervision by monitoring this data as well. On the 4th page, this is more on care management step. So care manager and care worker can track for each province where they are now and how many cases. And in terms of case plan and care closure, they can also track the status of approval from the supervisor, care manager, yeah. And also the last one, mainly on the service and the follow-up. So this information really provide information to care manager, especially also government at the district level, to provide oversight where they are now, how many survey provided for each period. And so after that, I will show you what the process that we have gone through to develop this piece of tool work. Let me go back to our slide. Yeah, so in the process of development of the Primero CPIMS integration, which means we actually developed the automatic connection between the Primero and CPMS, where CPMS can pull data directly into the from Primero into the CPMS platform. So with any process for these two dashboards, there's a need for discussion with key stakeholders, particularly the government stakeholder. There are already an understanding that any existing system available, such as the Primero, the government will develop the connection between the two systems. So in here, we have discussed with the MoSVY, who is the leading agency, and we start mapping what are the specific data that we want to show in the dashboard that can provide oversight to inform programming, policy, and advocacy level. So after mapping this data, we also define clear the workflow, right? If you can see here, Primero receive the data also from the NGO camp management system called OSCA, and with the Primero data, it fit into the CPMS dashboard. And through this process, we actually we're using the open function solution, which is a service provider that specialize in the integration of the different system. So it's called open function, and also open function support working with ONA, who is the service provider in developing the CPIMS dashboard. So we have two service providers that provide this technological support. And after we develop this clear workflow, we start to use the dummy data to do testing in the Primero MoSVY. So we have the Primero MoSVY. After we see that the data is going according to what we see, and also the visualization is correctly, so based on the dummy data, we start to release to live production. Means it's already available on the CPMS dashboard based on the real data. And the time frame for this development, I mean, the actual work is already take around maybe 3 to 4 months, but because we have at the same time, we also developing Primero with version 2 upgrade as well as the interoperability. Both Primero and OSCA need to upgrade, so it takes more than 1 year. And the cost involved of that is around $10,000 US. Similarly, in the process of development of the Primero dashboard to support the monitoring of the case management to the national supervisor and the caseworker, we discuss what kind of data that we need and for particular audience, and then we develop the data analysis plan. Just to add to this point is that in the past, we normally use the data that we analyze from the Primero that we extract directly from Primero report. And later, after we participate in the Q2 Primero Data Challenge that we have seen other country of we actually able to generate this data in the Power BI. So that inspired us to do the same, and through discussion with government, we decided to do similar thing. So we actually develop define database name based on the data that we need, and develop the API call to import data into the Power BI. So just to note also, both dashboard actually pull only anonymized data and only data that we need for the purpose. And through the process, we have transformed the data into Power BI. And after we see that, okay, it's already provide what we need, we develop into the dashboard. Also to note that in the process of both dashboard, actually it's good good practice to seek support from the regional Primero specialists and T4D country specialists and colleagues that have expertise in different areas to provide support. And it is we found it's very, very helpful to get their advice and instruction to arrive at what we have now. So I would encourage you to reach out to them. And the time frame for development take around 1 month because it's easy. It's only using software. And the cost you need the Power BI Pro license in order to be able to share that to the external user. And also the workspace premium, which we can also request from our actual office. And the dashboard is accessed in the embedded in the SharePoint. So only those that have the username and password that can access. So this is currently shared with the government social worker, all government social worker and UNICEF, relevant UNICEF colleague. And in order to do in the SharePoint, you can also ask support from your IT. So yeah, it's all for me. So Suman, over to you for the data utilization. Thank you.
Thanks, Paneth. Jan, I'll try to, I don't know how much time we have, maybe what, 3-4 minutes?
No, go ahead. No rush.
All right. So in terms of utilization, I think for us, the Primero, the dashboard itself and the whole data information system has really driven like a lot of child protection reforms in the country, which has been really, really exciting for us. And so we have used it, for example, for sector planning, for provincial planning, alternative care reform plan, and so all kinds of like the bigger planning processes. That's for the CPMS dashboard. In terms of budgeting, and that's also we used actually in a way to show, look, there is no data on this. We have an indicator that you all thought was really important, but you are not giving us any data. So that then like really spun, and then we working with the Ministry of Economy and Finance to come up with a system to record actual child protection budget itself, which is still ongoing process, but it's super exciting. The dashboard, as you just saw, is being more useful at the programmatic level because that's something they can use to improve the case management practice itself and monitor. The next slide, Paneth. Paneth?
Yeah. Have you
Next
seen
slide, please. Yeah.
Yes, already there.
Oh, I can't see it move. So
it's okay now? It's moving?
no,
Yeah,
but it's okay. I can
on our side. So it might be just delayed on Suman's side.
Okay. So I think that on constraints and yeah, I can see it now. Yes. So in terms of dashboard, we still have limited disaggregation at geographical and kind of agency level that, as you saw, we haven't used as much for planning purposes and resource allocation as we'd like to. We're saying we're there, but we're not fully there. The quality and availability of data across the 50 indicators isn't fully there, and the quality of the data differs. So Primero is great, and the inspection data is great, but not all the indicators. There's a lot of sensitivity, obviously, around some of the data. And the level of technology, as Paneth said, we've used for most of them international vendors, actually. And there's very limited in-country technology support in that. The dashboard, again, is not as disseminated as widely as we'd like. So, so it cannot be, it should be better disseminated. And that's what we're focusing on in kind of future. We would like to have more disaggregated data, and we would also like, people to actually use it more. So lessons learned is, I would say, it's very important to embed our data programming as part of the broader child protection reform programming. That's very important. We do need time to develop informational needs and indicators and overall system. Otherwise, it becomes very much a patchwork and ad hoc pieces of work. Sharing of protocols, very important, and use existing best practices and vendors rather than just developing something completely new or, something that hasn't been tested. More time is needed for consensus building, and we think that's very important. Very important to ensure why data is being collected and what protocols to follow, including for visualization, actually, because especially when you're working with the government and different partners, people have different agendas. And sometimes I want this data or I want that data. And what is it for? Is it to really improve practice, or is it just to like harass caseworkers, for example, right? So we have to build that balance. And again, that was the last point again, is that we have to just make sure that people want these dashboards for actual use. And for us, like we've used it for, like research purpose. So now we recently had somebody look for social workforce related data, and we said, we'll just go into the CPIMS dashboard, and that's what they're using. So we're not going back and forth giving this data and that data. They can just use the dashboard. Similarly, recently on the online protection programming, we could just show to the government. Actually, in Primero, you can see, okay, type of concern. And child protection online concerns is reported is very low. So we can show it to the government. We can say, look, it's not being reported to whom it should be reported. So they can see that. And it's very easy to then build a case why they need to invest in this system. So we have this, high level, multi-level of like utilization that's going on. And these are the lessons learned. I think that's the last slide, Jan. Yes. Thank you. Any questions? I don't know how you want to do that question answer.
Thanks so much, Faneth and Suman. That was fantastic. I'm just looking at the chat. Anyone who has any questions, please go ahead into the chat, or feel free to take the mic. I guess I just wanted to highlight, it's been such a comprehensive and complex implementation, being able to do this integration and having, as you saw, just so many dedicated focal points who are helping in this development was very key. But really, like, the focus was on having an information sharing protocol, making sure that information is anonymized. But it's just so nice to be able to see that these data trends can be actually used for advocacy and things like that. As people are coming up with questions, if they have any, I did have a question for you guys, which may be helpful for other people. What was the process with the government like to get their buy-in in the beginning, and how have they actually supported you in the development of the CPIMS?
As I say, we started a long time ago. So, we had this big workshop where we decided what is the need for data needs, and government had identified child protection data needs as one of the gap. So, I think they understood that need, but we also took time to, as we said, to develop actually the monitoring framework and the protocols and systems. And slowly, even the dashboard is taken us years, right, to actually finalize it. And they've been part of this process, even the design of the website itself. So this is our second version and stuff. So they have been in this. For Cambodia, digitization is one of their priority agenda. So that has been good. But yeah, they've been relatively easy in some way. Panet, do you want to add?
I think, Suman, you have covered very well in terms of the engagement with the government.
Perfect. Great, thanks, Suman. We have a question in the chat from Nebraska. Is there any kind of challenges or issues of data protection that we need to consider and pay attention to when linking the Primero data with the Power BI dashboards?
Panet, maybe I'll let you answer that.
Thank you so much. So in terms of the challenge, actually when we developed the integration between the Primero and we actually have also sharing the data with the NGO called Oscar, right? Oscar. So any data sharing need to have put in place the data protection and sharing protocol. So we actually have a signed agreement with government and also with relevant user agency in the Primero. So there's already agreement what kind of data we want to share and what kind of anonymized data that we want to connect with the So after that, we also have a different discussion with government. The important point is to have an ongoing discussion with government. Of course, like there are some challenge, like even their data protocol in place, but there like maybe political issue to consider as well. Like Suman mentioned, maybe the interaction between government and different agency might not be what is straightforward, so that we need to take into account. And to address this, we can discuss with the partner to actually to clarify if they actually want to share the data publicly. But in terms of the current data that's shared on the CPMS, it's only like Oscar, there's no individual agency, but in terms of Power BI, we actually used to have individual agency. But like I mentioned, we can have a meeting with NGO to clarify if they have any concern politically from sharing with the government. Yeah, I think that is the way to address it. Thank you so much.
Thank you, Finette. That was very well put and very diplomatic, I think. Any other questions from the group? And you can feel free to unmute as well. I'm going to also just put in Suman and Finette's email in the chat. Sorry, go ahead, Sunita.
Thanks, and hi everyone. I hope you can hear me okay. Thanks so much for the presentation. I'm looking forward to engaging with both of you through Mohan further in EAP. But maybe just a question in terms of how, once you have this data that is coming from the CPIMS and also recognizing the many other IMSs that tend to exist with government counterparts, MOH, MOE, so many others. I was just wondering about how all of that is playing out, both in terms of the data coming from CPIMS, any integration with that, but also, in bigger picture where we have governments trying to tell the story around violence from multiple perspectives and through the data that's coming through their own systems, how you're beginning to navigate that. And I hope that was clear.
Let me just maybe answer something, and then Panit, please do add. So no, I think that's a really great question. And actually, when we started it, we want CPIMS to be the authoritative source for child protection data. So that was very clear to us from the very beginning. And all our engagement and agreements with the government from the very beginning has been around that. So it was like, if you want child protection data, this is the source, this is the government agency. So like whatever data needs to flow through this one. So DHS is also pulled into here. The CD data that we just released from the DHS, the child discipline, is also in the CPIMS. So inspection there. So most of the important data that the government is collecting is already channeled through CPIMS dashboard. So, and the government has actually child protection sector plan and provincial plans and all that, and they also refer back to this. So we're going to be doing more of that, making sure this becomes, always the reference source is CPIMS. So we're working more and more, but actually that's, but I think we're kind of on the right track. It's embedded into that.
Great question. Thanks, Sunita. Any other questions for the Cambodia team? Okay, great. I'm going to put in their emails in the chat if you would like to reach out to the team. And with that, I just want to say thanks so much, Suman and Finette, for taking the time for putting together this presentation. We're very lucky that the team will also be presenting in our Primero annual meeting in November as well. It's just been super fantastic working with the team, and looking forward to hearing more about this. Please feel free to reach out to them if you have any questions. And with that, I hope Abid is back at his computer, and Abid will be presenting next from the Jordan team on the Primero Insights. And Abid, just let me know if you would like me to present your PowerPoint for you, or if you would like to go ahead.
Hi everyone, so sorry.
No, that's
My
okay.
laptop was dying. I had to run to get a charger. I'm so sorry for that. I had to go for a couple of minutes and come back. If you, it's okay. I can present directly.
Perfect. Sounds good.
Thank you.
No problem.
Hope everyone are all right. My name is Abdulrahman Mkahal. I am Information Management for Child Protection Section in Jordan Country Office. So technically, let me just start the presentation. Okay, so technically what we decided in Jordan in the last year is to actually have an integrated reporting tool within our system itself. I don't know if everyone is familiar with TSFV, Tracking System for Family Violence, but in Jordan Country Office, we have like a national system for tracking of or for managing of cases of domestic violence and sexual violence in the country, owned by the government, managed by the government, hosted by the government as well. So it's fully owned by the government. So this is technically our first requirement for TSFV or Tracking System for Family Violence in the country. So for the Jordanian context, reporting is a crucial element for the system success, enabling the monitoring of progress, data entry, oversight of business workflows. Additionally, it serves as a mandatory component for partners management. So what do we mean by mandatory component for partners management? Is technically our partners who are using the system, which is 3 ministries and the Family Protection Department, managements do require to actually have a look or an oversight to their own teams' progress, achievements, what they have been done, and so on. For planning for insights development overall, it had to go through 5 main steps. The first one is the planning. What are the needs for reporting and how these reports will support the SFE implementation? To highlight some of the items that in the beginning were focused on the planning from the beginning is actually to have a sustainable tool for reporting. So we could go with the third-party tools. We could go with just exporting, extracting, and do the reporting manually, or actually use the reporting tool which is embedded already in the system. However, the reporting tool which is embedded in the system itself currently have some limitations. Everyone knows that there is a 2x2 reporting. You can't have multiple filters. Sorry, you can't have multiple items or columns in the top or in the columns or rows. That's why we needed a different tool. This is one thing. The other thing is we needed something user-friendly for the reporting. A tool that anyone can use, can create the report however they like and see the results that they want to see quickly without having the issue or having the need to go back to a data person to develop the report or to actually extract the report needed. So in the planning phase, this was part of our focus. The second part was what do we need, what we actually need from the plan. We just gathered all the reports we had. We had more than 28 required reports, and we did an assessment for all this. We disseminated the current available reports that we have, and we assessed what is missing, what we can get from the current reporting tool, what is missing, how can we help all the people who are working in the field with the reporting tool. Next step was the designing of the reports. So we captured the indicator, we captured everything. Now we want to design how they will look like. What do I want to see? Do I want to see, for example, just the overall numbers? Do I want to see type of violence? Do I want to see the response type that's happened for the case, and so on? And then the first step came, which is the development, and this was partially, and thanks for the Primero team for that, mainly the role of the Primero team to help us with that. So thank you, thank you Primero team for that. And currently we are in the testing period and the launch. Soon it will be launched to production. Currently, it's available on alpha and available also on the demo site. And so we are currently just assessing, testing the tool, seeing if there is any issues, anything that does not meet the requirements, and so on. The areas of focus that we focused on during our planning and assessment period, we wanted to see cases by workflow, cases by type of violence, how many cases have been transferred and referred as well, the referral and transfer status as well. So cases by workflow, it shows us the number of cases by a workflow status, open, care plan, case plan, and so on. It capitalizes on how many cases each group are dealing with and support assessing the workload. The main need for the cases by workflow is to actually assess what is the current workload of each user group within the system. For example, for Family Protection Department, we have 17 branches around the country in Jordan. And this will show the head of the department how many cases each group are dealing with on a daily basis, on a weekly basis, on a monthly basis. What is the status of these cases? What is happening to these cases? Are they still open? Are they closed? Are they in the case plan process? You will see soon in the system how they look like. So this will help the decision makers within each organization. And this is why it gives the higher management an insight on how to plan resources and areas of support. It could tell them if they need more human resource, for example, in a specific area than the other one. And the second area of focus we had is cases by type of violence. It shows the number of cases by the type of violence, since TSFV focuses on specific types of violence, which is physical violence, and sexual violence outside the family, and neglect. It shows the number of cases by type of violence overall. It can help us with the statistics. It can help us establishing a baseline for targets for the upcoming years. It also supports us in analysis of data trends by location and type of violence as well. Last thing is the transfers and referrals. The transfer shows the number of transferred or referred cases. It assesses the linkages between the agencies and provide an insight on the needs for each location. And I really believe this will help us in the future, especially in the expansion part. How can it help us? It can tell us, for example, if I have a group in location A, two groups in location A, and these two groups are providing case management. However, they refer a lot of cases to a group in a different area, area C, for a specific service. This will tell us that this service is missing in area A. So this will tell us in the future on how to actually plan our services. Where are the missing services? What are the needs of the services by location, by even human resource, and so on. Why did we choose insights? Actually, there are many reasons. I just added 3 main reasons. However, I do believe there are many reasons why we choose insights. It's not mentioned here, but the first thing is to actually have a tool that is available without having the need to go back to a third party, to go back to your, for example, if you are a supervisor in an agency, you don't have the need to go to your data person and ask him to export a report or something. This is one of the most important things. And it's an in-system tool. You can access it through the system. You will avoid having to use a third-party tool, which will be more efficient and less time and resources consuming as well. The tool is user-friendly. You will see it now. It's very user-friendly. Anyone can use it. It needs a very minimal training if the person really lacking the capacity to use a computer or the system itself. There are simple filters that allows you to capture the data, agencies, groups, date, sex, and age groups. In like 2-3 minutes, I will show you directly. Last thing is accessible. Why did we focus on accessibility? Is actually anyone can access the tool as long as they use the system, if we do give them the permission to see it. So, for example, if we found or we decided that supervisor within each group need to see this tool to see the report of their own group, we can just enable this permission and they can see the data for their own group. So it can be accessible by anyone. It can help supervisors, it can help higher management, it can help donors, it can help UN agencies, everyone. So it's very accessible. And we can always configure a username for reporting only for donors or UN agencies. Myself, this is my my access is only reports, so I only see statistics in the country. One more thing is for TSFV, it was a requirement by the government that no single individual can have access to all the data within the system. So this might be a surprise for some of the people who are attending, but yeah, for TSFV, no one at all have access to all the data in the system, not even the administrators, even though they are government officials. I don't have access to the data in the system, the raw data itself. So we can't export the data. So it will be very challenging to us to have a third-party tool. Even if we access the data, it will cost a lot, especially in country. And it will be hard to maintain. So this was like a huge reason why we needed a tool in the system itself without the need to actually access the data. Of course, every tool, every reporting tool, I believe every app or software can be improved. And this has been like evident is every application, every or operating system, every technology that comes, the next year you will see improvement to it, you will see it better. So everything needs improvement. But for our insights, what type of improvements can be done? We can have more indicators. Currently, we have only three type of filters: type of violence and transfer and referrals and workflow. Insights can be improved by adding more indicators such as estimation for case response. This is just an example. We can see risk assessment. We can see for CPIMS user, for example, you can have protection concerns and others. You can, of course, you can have more additional filters, additional tables. In the current system, you will see in a minute that you will see only one table that shows everything. We can have additional tables with more disaggregations, such as case status or risk assessments, standardization. For our tool, it's very, let's say, customized for TSFV, but I believe it can be standardized with different contexts around the globe. It would be better if the indicators within the tool are standardized. This will allow the tool actually be available to every context and an instance. Summary: with insights, we will have a tool within the system that will give us trends, progress, assessments, and easy to use tool that can be available for every user. This is the overall presentation or introduction to insights. Now I'll try to show you insights quickly. So to access insights, you just need, this is the demo site for tracking system for family violence in the country. You can access it through the menus to the left. There is a separate tab for it. It's called Insights. And then you can filter from here. You can view by quarter, month, week. You can even, for example, if I choose year, I can just customize and choose a specific date. For example, let me choose not July. I want to choose an earlier date because there is not much data in the demo. You can choose the status of the case, either open or closed or both. You can check what is the workflow status. You choose one specific item for a new, reopened, immediate response, comprehensive response, service implemented, closed. I will leave it blank for now. And then this is the most important part of it, is you can choose to filter by either user group of records owner, user group of record creator, and agency of record owner, agency of record creator. Let's say user group of record owner. And then you can choose the user group. If you want to see just a specific user group within the system, you can see by it. You will see some Arabic. Oh, one very important aspect of the tool that is, and this is very interesting, especially in our country, is it is available in both languages, Arabic and English. So it can be available for even non-English speakers in the country. So this is how it will look like. It will show you a nice graph here that show female, males, and the total number of cases. And below you can see in 2023, we had by age group as well, we had 68 male, 67 females, and so on. So when I was talking about improvements, we can have a second table here, for example, to show us, let's say, segregation by male, female, and as well as it can be workflow status. Okay, this is for cases, and it's also available for incidents. This is the incidents. How many incidents have been created? What is their situation by workflow? This shows a new, for example. It will show you these are only the new incidents recorded in the selected period. I want to show something exciting. If I want to see it by month, let's choose again from January to today. Apply. Oops. See cases. By week. It's still under testing, so this is fine. Yes, here you go. Like I said, we are still testing. It's only available in the demo. We will follow up on that issue. So here it will show me by date, by week, by every week. And in Jordan, it's from Sunday to Saturday. How many cases have been registered and what is their status? By weeks only. So you can see, you can just use 1 month and see every week how many cases have been entered. And this supports the management and decision maker. So this is cases by workflow. The second area of focus was type of violence. I already used the filter to see how many cases with sexual within the family cases for this year open. And you will see here a table, same. This is all the cases for with type of violence of sexual within the family. In 2023, 0 to 4, 5 to 11, 12 to 17, 18 to 59, and 60 plus. This is the age groups that we have. And also, last but not least, and this is how many referrals have been done, for example, this year by group. By group, I mean by user group. For example, we have a group named MOH Ministry of Health Amman referred 8 cases to also within the same agency because they provide the service for MOH Amman. For example, FPD West Amman has referred 1 case. FPD is the Family Protection Department has referred to 1 case to health services within MOH Amman. And this will help us to know how many referrals are open, what is the status, is it accepted? For example, if I apply accepted, we will see just 1 case have been referred by Qasbat Amman. Qasbat Amman means Amman Center to JRF, Jordan River Foundation, Amman. If I want to see how many have been pending or not accepted, I will see, for example, these groups referred to the current groups in the above here, 15 cases. And I will see a nice graph here that will show me how many cases have been referred. Same for transfers. It's the same. It will show me how many cases transfers are pending, and it will show other filters as well. So basically, this is the Insights tool. And I do believe it can be improved more. Currently, in its status is very good. And it supports as well our expansion in the country for the upcoming years. And it will also support us as well to plan the needs and targets for the upcoming years. Thank you, everyone. And if anyone have a question, please feel free to ask.
Number S, please go ahead.
Yes. Hi, Abid and all. I have like very simple question, please. Thank you for the presentation. My question is, who will be the one who will gathering and like have the access to be filling the data in that kind of system? And I mean, like, is it only the social worker from country institutions or who other else? And also concerning the location scale, will it cover like the whole country, or like is an ability to cover the whole of country, or maybe you will do the piloting in first specific location, then step by step you will like expand to cover the whole country? And I have a second question, but after you finish, I finish this like I will post the second one. Thank you. Over.
No worries. Technically, the data is already in the system. It's whoever is using the system for Ministry of Social Development, Ministry of Health, Ministry of Education, and Family Protection Department, as well as NGOs. Whoever using the system for case management and responding to cases of violence, as well as sexual violence, they enter the data. This tool extract the data from there within the system itself. So the people who are responsible for entering the data are actually the social worker, their supervision, and whoever working in that cycle. And the tool itself just extract the data from the system itself. So whoever have access to the tool can see the data. For tracking system, I see you are interested in to know how tracking system goes. Tracking system we have piloted in 2023. We started the pilot phase only in one location, which is East Amman, the highest with the highest in population density in the country, and there is still no official final report published yet, but we know that it have been successful. Almost 7,000 or 7 or 8,000 cases have been entered, and so on. So it's piloted within East Amman, one location in the country where we have all the partners and the highest population and the highest density of work. And it will start expanding starting in the beginning of next year. The pilot phase has finished, but partners continue to use the system. Yeah.
Thanks, Abid. Just to follow up, we have a couple other questions actually. Maybe Aminu, you can go ahead first. I know you went off mute.
Okay, yeah. Thank you so much, Abed, for the presentation. I'm just wondering if the insight is replacing the reports that we have in the CPMS, because I see that there are a lot of filters in the insight, and I just like the insight. So I don't know if it will be replacing the reports that is in the CPMS. Thank you.
That's a great question. Go ahead, Abid.
Yeah. No, it won't replace the reports. Actually, the reports have been improved already. There are additional filters and reports they work with, thanks to Primero team. They worked on it this year, and if you are using the reports, we have new additional filters have been added this year, and we already use the reports. That's why you have seen that we focused on specific things that is not available in the reports, because we already have the reports for many things actually. For example, transfer and referral, it was very hard to capture through the regular reports. So insight will remain, and the reports will remain as well. You will have both, which is amazing, I think.
Exactly. And I just wanted to add, so something that we talked about in a previous data challenge were the changes that we had made in the Primero database. So we went from Solr to Postgres, which is really the backbone of being able to design these insights and improve the reports. So slowly but surely we'll have more and more reporting, because I know a lot of you on the call who are system administrators are doing that kind of aggregate anonymized reports for all of the different partners and governments. Robert, please go ahead.
I just wanted to take a moment because Abid and Faneth and Suman have been very kind in thanking us. But what I think is an important part of this story is, and one of the objectives of this data challenge is the strengthening of this community. And a part of that is understanding where these resources come from. So there's two important points I want to make here. One is that what you're seeing in these examples, not just today, but in the previous data challenges, are changes, investment, effort that goes in to meeting requirements that come from the field. So these come from users, they come from our partners, they come from organizations in the field. There's a demand, there's a need for this type of functionality, for these new features. But it also, there's a challenge at the global level, because what we need to do is make sure that the things that we're investing in and that we're building and developing, that they can benefit everyone. So in the case of Jordan, working with the Jordanian government on this very unique, very one-of-a-kind implementation of Primero, which is very similar to the CPIMS, but it's not the CPIMS. Hearing the government and those partners that Abid's working with saying, we need this, we need to be able to report referrals by date, by user group. You know, we do a job at the global level of aligning those requirements so that they are similar, so that we can find what's similar between these different places and focus on those things, so that the investment that a country office like Jordan is making can translate into changes for the CPIMS Plus, which is what we're working on now. We're contracting that work now and moving it forward. So for those of you that work with the CPIMS Plus, this is coming as a result of the work done by Jordan to bring up those requirements from their partners from the field level, then for us to sort of synthesize those into global development stories and deliver those for everyone. So that's part of the reason that we're all here. I just wanted to say, you know, a lot of the effort, a lot of the work is happening at the field level. So congratulations to the teams for keeping those good ideas coming to us, and we do act on them when we're hearing the same requirements from a whole bunch of different places. We act on those, and we queue them up so that we can keep our product moving, developing, and growing. Thanks very much. I have to jump off now, Jan, for a few minutes. I'll try and come right back as soon as I can. Unless, Sunita, your question was for me, but I'll answer it before I leave.
Sunita,
No,
please
it
go ahead.
wasn't.
Okay.
I also see that there are questions in the chat that I don't want to jump in front of. Jan, if you want to go to those first. And also,
Oh,
Abid
sure.
probably already can anticipate my questions.
Perfect, thanks. Abid, so the questions in the chat, thanks, Anita, and then I'll go back to you, is how will you make sure of the data quality through the third party, and a few points that you want to highlight in the process, if applicable. And then there's also a question from Lama about, can we see a user with no access to the data with insights access only?
Okay, I will first answer the first question. I don't understand through third party, because we don't have a third party. This is the main idea of the tool, is not having a third party. So data quality is done at the system level itself. We don't use third party tool at all. It's run by the government, supervised by the government, managed by the government, administered by the government, hosted as well by the government itself. So it's fully government owned system. This is why we decided we wanted to have a reporting tool inside the system itself, embedded in the system itself. So If we do it now, we don't have to worry later on when we hand over the whole system for the government to manage themselves, because we want something sustainable to stay with them in the upcoming years, to ensure that this will be maintained, this will be updated, this will be they will have the reporting tool, so they don't need to worry about licensing or anything. يعني, this is how for data quality, that each agency are responsible for their own data quality in the family violence tracking system. So yeah, on the process itself, I'm not sure if the process of the reporting, we actually highlighted, we had all the report, let's say, needed from the system drafted outside the system, paper-based or Excel. Then after that, we checked what reports are available already in the reporting tool, and reduced the number of reports required. Then we reached out to Primero team. We told them that we need this reports. Is there any way you can help us? And then insight was proposed, and we went with it. This is mainly the whole process. For the second question, can we see a user with no access to the data with insight access only? Currently, we still did not test that, but we do have a user for reports who can see report statistics with no access to any records. If you are interested to see this, I can open one. I can open it now and show you. Just please let me know. Lama. I think these are all the questions.
Perfect. Thanks, Abid. And Lama, yeah, if you would like us to show that, I know we're just in the testing phase, which is why we didn't really showcase a user with only access to the insights. I'm going to hand over to Sunita just for your question. Please go ahead.
Well, thanks so much, Abid, and congrats as well on the work. Obviously, you and I know each other well and know this work together well. But I actually have the same question for you that I did for the team from Cambodia, as it's also an issue that I know we've talked about in terms of the way in which this interacts with other systems. And I think, unfortunately for you, maybe, I know Jordan quite well, and we know a lot of the challenges where many ministries have different systems and they're sticking to them. But it seems like with TSFV, there's still progress, at least in terms of some of this tracking. So I was just wondering if you could speak to the ways in which you have been or are and continue to try to link these systems, and sort of what the incentive is for, let's say, a Ministry of Health that has a strong system that's separate, or a Ministry of Education that has a strong system that's separate, how you're trying to bring those pieces together. Because I do think the tracking of referrals and transfers is such a critical one, especially when there are multiple systems, but that also involves these other bodies to buy in and engage. So any thoughts you have on that would be great. Thank you.
Thank you, Sunita, for the question. It's been a long time. Hope you are doing all right. Okay, for linkages or interoperability with other systems, everyone knows that Primero is friendly. It can be integrated with other systems, of course. Since the system is still on the pilot phase, there is still no integration with the other systems. We have on the table actually linking the system with the what's called I forgot what's called in English. The civil registration, sorry. With the civil registration, actually, to just automatically, whenever you enter a national ID, it automatically fill out the data. This is on the table as well, not just linking it to Ministry of Health and Ministry of Education systems. However, because it's still on the pilot phase, we still did not, let's say, expand the system in the whole country. We cannot open these discussions. In terms of linking it with the Ministry of Health system, Ministry of Health system focuses a lot on the providing healthcare services. However, there is still no linkages between TSFV and it's called Hakim system. We are trying to initiate the conversation, but still no progress on that term. For Ministry of Education, we did not see with the EMIS team, I think EMIS system, I think it's called. We did not see any common interest between both, since number of students is extremely high. Number of schools are also very high. We have 4,000 schools in Jordan. It's better just to have it in a like minimum level of work. Yani the way schools are dealing with the system, specifically Ministry of Education, is different than everyone else. That's why there is still no linkages. We don't see any need for linking it with the school system currently. Over.
Great, thanks, Abid. And hope you're well also. It's good to hear you.
Thank you.
Great. Thanks, Abid, and thanks everyone for your interest and your questions. I know so many of you are doing reports and asking me questions directly about how we can improve them. And just as Robert said earlier, really, we want to be able to enhance these insights and make this more applicable to all of your programs. So if this is something that's interest to you, and if you think that your program can help in investing in the development of new insights, please reach out to us at any point. And Abid, thank you so much for your time and the presentation. Abid has been key in making this first ever, actually I have to say that this was the first ever government-owned implementation of Primero, and this has been a long-standing implementation, at least as long as I've been a part of the team. So really have been excited that this is where we're at now, and we're able to see these trends that inform the programs, and looking forward to seeing more again also at the Primero annual meeting. So thank you, Abid, so much for that. And with that, I would love to hand over to Megan O'Brien, who's joining us from IRC. This is going to be, I think, quite interesting for most of the CPIMS Plus colleagues that are on the call, because we don't really have any programs that are doing what Megan is presenting on. And Megan, just let me know if you'd like me to put up the presentation, or if you'd like to present yourself. Thanks.
Yeah, you're welcome to present
Perfect.
for me, if you don't mind, just because there's that video and I want to make sure the audio works for everybody.
Oh, perfect.
Excellent. Well, yeah. Hi, everyone. Thank you so much for having me present and share at the Primero Data Challenge. I joined a bit late, but everything I heard was really exciting and interesting. As Jan mentioned, I'm Megan. I'm the Case Management Data Specialist at the International Rescue Committee's Violence Prevention and Response Unit, and I support IRC's Primero instances, as well as sit on the technical team for GBV-IMS and the steering committees for CP and GBV-IMS. And I am excited to talk to you today about how we can responsibly use sensitive data to improve GBV programming. So my talk will focus a bit on GBV programming specifically, but it's applicable across sectors. Next slide, please. So I'm going to introduce you all to Samira today. She's been working in the humanitarian setting for decades. She's navigated ways to provide services to women and girls in active conflict zones and during a pandemic. And even with her vast experience and knowledge, there's one conversation that she really dreads. And it usually starts with a couple of questions. Maybe they sound something like, I've heard that GBV is happening to women and girls in the community. Is this true? Can you share your data? Next slide. Samira knows that GBV programming for women and girls should be evidence-based, and that by measuring our work and our case management services, we can learn invaluable lessons and identify gaps and opportunities that will improve services. So we know, and Samira knows, that data can be really useful. Next slide. And she also knows that there are significant risks, and that data, especially on gender-based violence against women and girls, is highly sensitive and open to misinterpretation and use. Next slide, please. So how can Samira, knowing all of these risks and the need, still be responsible with the data that's entrusted to her by survivors of gender-based violence? What would help her when she's asked to share this data? So we got to thinking, one possible safe and meaningful way forward is that she could easily generate safe, aggregate, and anonymous information about reported GBV cases, and then use that actionable data to improve and inform her programming. So we're going to dig into this example a bit more, what we're looking at on this slide here. First, we need to know how, you can stay on that slide, Jen. Thank you. So first we need to know how to get to safe, actionable data. And to do this, we need several things to be in place. So you'll see at the bottom here, we're going to need standardized forms or a common minimum data set. We'll need common indicators for outputs and outcomes and guidelines on how to interpret those indicators, as well as sector commitment to use this data. And this together will lead us to safe and actionable information. Now we can go. There it is. Thanks, Jan. So to do this, the IRC turned to and worked with Primero, which we're all familiar with, so I'm not going to introduce that here. And as you know, Primero uses and securely stores standardized GBV and CP case management forms to support the case management process. So with some funding, we were able to develop a set of key performance indicators or KPIs that were based off of the standardized GBV case management forms that are automatically generated in the GBV module of Primero. So these KPIs provide output information like the number of cases or incidents or the number of safety plans completed and the rate of case closure. And these, of course, are all protected by role-based access. And one indicator, such as the number of recorded cases, could be paired with other indicators, such as the average number of follow-up meetings per case, to help practitioners better understand the breadth and depth of GBV casework or the time and effort invested in supporting disclosure and providing GBV case management. So while we were working on these KPIs, simultaneously, we were able to embed the GBV case management outcome monitoring toolkit in the GBV IMS Plus case management files, allowing end users to digitally collect information on the outcomes for women and girls engaged in GBV case management. So within Primero, we were able to develop the automatically populated KPIs for outputs and also incorporate existing tools to measure outcomes. Next slide. So I mentioned the GBV case management monitoring toolkit, which you may not be familiar with. And like I said, these can be used to determine outcomes rather than just outputs, specifically related to psychosocial well-being and felt stigma. These are two 10-item questionnaires that can be used separately or together to determine if a survivor's well-being or felt stigma has changed throughout the GBV case management process. So this aids in adjusting individual case management as needed through better targeting of services, and it can also be used for aggregate analysis and data sharing that focuses on outcomes. If you can go to the next slide, Jan, and this is actually a video. It's a short video shared by a colleague of mine, actionable, and who's a GBV response officer in South Sudan. And she's just going to share a bit about how they use the psychosocial well-being scale from the GBV case management outcome monitoring toolkit that I just mentioned. So I'll mute myself for a brief moment.
Thanks, Megan. And do just interrupt me if you can't hear the sound.
everyone. My name is Achom Lucy. I'm a GBV response officer in Ajongtok refugee camp. And we are using the GBV case management scale in our programming here. Why we are using the scale is because it helps us to assess the survivor's psychosocial well-being. And how we are using this scale in Primero is, one, it's administered during the baseline survey and during the follow-up surveys. During the baseline survey, different questions or statements are being read out to the survivors in line with their psychosocial activities. And the first one, it is rated at 0, which is not difficult at all. We have a little bit difficult, which is rated at 1. We have difficult, which is rated at 2. We have very difficult, which is rated at 3. We have so difficult that is rated at 4. Okay? These scales help us to analyze and to assess if the survivors need more further additional support. It also informs the program to assess the psychosocial well-being of the survivor. Okay? It also helps us to understand the survivor's further needs. Programs are also in position to close the cases. Thank you.
Thanks,
Hello,
Jan.
everyone.
So that's just a bit about how these surveys are administered during the case management process, which is again reflected in Primero in the forms themselves. We can go to the next slide. So,
Sorry.
oh,
It's
go
just,
ahead.
I'm having some technical difficulties on my side. Just give me a second. Please
Yeah,
go
no
ahead.
worries.
All right. Sorry, there you go.
Perfect. So we talked about these automated KPIs for outputs and the surveys for outcomes. So what does this look like in the GBV case management process? With these standardized forms, the KPIs and the scales available in a single digital system used by GBV program staff along with guidance, if Samira were asked to share her data, she could easily share the aggregate anonymized indicators that are automatically generated in this system in Primero. Actors using the same interagency platform or the same minimum data set for collection would have a shared understanding of what these results might mean and what other data points they could triangulate for further interpretation. And they would have the guidance to help nudge them on possible interpretations. But the cherry on top is not just that the KPIs and the GBV case management outcome scales are all in one system. It's that they come with a comprehensive companion guide that has also been developed by an interagency group. And this companion guide has 3 parts. If you want to switch to the next slide, Jan. It goes through the standardized case management forms and their connection to the case management process. Then it goes through remote supervision that can also be done through Primero. And finally, it talks about monitoring and evaluation. The latter part of the guidance details how to analyze and interpret the KPIs and the outcome scales that are embedded in the system. We have indices built out of different interpretations to give you a clue into what it all might mean, making it far more actionable from front to back. So what does this have to do with everyone here today? If you happen to be a GBV practitioner, you can use these tools and the guidance, even if you aren't using GBV IMS Plus, but especially if you are. And like I mentioned at the beginning, these ideas aren't just for GBV or protection actors, though. These ideas are a replicable model for other sectors and platforms. And when we all act responsibly with data, it improves the field overall. So instead of ignoring the rights of people accessing services or not using sensitive data at all, there's a middle ground, and that is safe and actionable. So with those standardized forms, with the common indicators, including the guidance on how to use and interpret them, along with sector commitment, means that we can eliminate the need to share identifiable or potentially identifiable information and make the information we share more actionable, easier to generate, and easier to use. It means that we can have richer discussions about the meaning and use of data. So we know that GBV data needs nuance. Having a standardized base through those forms allows us to share a set of guidance customized per indicator that tells you about the definition of the indicator, the objective of it, the way it's calculated, the assumptions and limitations, and importantly, contextual clues, which give you just that, a clue into all of the different things that an indicator or KPI could mean. So when paired with other information, this can give us a clue into how to interpret that one number, leading to more actionable use of that indicator. So to use a slightly oversimplified example, I may know that my reported cases went up last month. And I also might know that's when my organization opened a new site. I compare that indicator data piece about reported cases with my anecdotal information about site opening, along with other information to determine if that new site is the reason why GBV case reporting increased. This is a very different and more accurate picture than just sharing the number of GBV cases alone and having no context into what this could possibly mean. So without this contextualization, simply sharing the number of GBV cases reported, someone might assume that that means an increase in GBV. But with this indicator, there are many contributing factors to consider. And that's what this guidance that I mentioned is highlighting. So having all of these features, the KPIs and the GBV case management outcome scales in Primero, which is governed by an interagency group that includes frontline service providers and UN agencies, means that it's sustainable, scalable, and usable by the entire sector, and most importantly, built by the practitioners who will use it the most. And like I mentioned, all of these features are available in the GBV module of Primero. And if that isn't in use, this is at least a model to follow for how to responsibly use sensitive data to inform and improve programming. The next slide is just highlighting some data art that we had an opportunity to work on with a data artist named Shirley Wu. We used the data from the felt stigma survey that's embedded in the Primero case management files, and we were able to see and to showcase through a website visualization a positive relationship between GBV case management and a reduction in felt stigma. So we know case management alone doesn't resolve all feelings of stigma. Mitigation requires a pathway that also emphasizes improved social networks, a blame-free community, support for survivors, a functioning justice system, and male involvement in changing norms and promoting gender equality. But it can address some of the conditions necessary to ensure that women and girls experience reduced social consequences after surviving GBV. So I wanted to show this visualization, one, because it shows the analysis we were able to do to prove that the case management services had a positive impact on the survivors receiving them. Also, there's just a really great opportunity for us to look at the outcomes of these case management processes through Primero and make the the results, the analysis, accessible for advocacy purposes. So I'll share the link out to this website if you're interested in looking a bit more. It was a really cool project to see how we were able to take the data forward and for advocacy efforts. So regardless of if you're using the GBV module of Primero or not, you can responsibly use the tools that I talked about and sensitive data to inform and improve programming. And these ideas are transferable to other sectors and platforms. And there's some key takeaways that I just want to highlight. As a GBV practitioner with access, or any practitioner with access to sensitive data, sensitive survivor data, protect it first and always. If you have access to survivor data or child data, if you're uneasy or having doubts about a data request, talk to and ask for support from your supervisor and relevant senior program staff. You can all utilize the GBV Case Management Companion Guide for standardized forms and their connection to case management processes to understand how to provide remote supervision using Primero and how to analyze and interpret outputs and outcomes produced in Primero, including the key performance indicators and GBV case management outcome scales. And there's no need to do this journey alone. Interagency efforts are needed to advance the whole sector. And I think that Primero is taking advantage of that opportunity in a significant way. So to stand behind the use of data in this sector, we have to commit to due diligence pertaining to the experiences that a survivor has shared with us in their effort to get aid. Our job is to do better with data in a responsible manner. And on the last slide, you'll have my information if you have any questions, as well as some links to resources that I mentioned today. So that includes the Case Management Companion Guide, as well as the Data Visualization site. I'm also happy to share my screen quickly, Jan, and just do a very quick demo on the KPIs in the system. It's a demo site, so there's no data to actually show some outputs, but I think it'll still be helpful. All right, so I'm logged into a demo site of GBV IMS Plus, and in the navigation menu, you'll see that there's a place for the KPIs. It's called the Pulse in the system. And you can scroll through each indicator. There's 15 active indicators in GBV IMS Plus. Each one has help text to better help users understand what the output is telling you. You can also customize the data that's accessed through the calculation of the KPI. So you have the last quarter of the year or the last 3 months, the last 6 months, last year of all time, or you can customize the timeline as well. So it's a really usable data set that, again, is automatically calculated based on your role-based access and has some really interesting outputs that you can use with other data to get important, actionable information accessible. And then a quick case file I can show you. Here are the case file forms for a new case file. And these are the scales. You have the psychosocial well-being and felt stigma scales. These are subforms because you can add these throughout the case management process. Oftentimes, these are used throughout the life of an open case and not just once, which is why they were developed to be subforms, so you can add multiple. And you'll enter the information based on what a survivor responds with. So you can select the response to each question. And at the end here, you can enter the score and any notes that you may have specific to the case. And that's it for me. So thank you so much, everyone, for letting me share some of the work that we've done on the GBV module for both data but specifically actionable data to inform case management processes and programmatic decision making. It's a really exciting space to be working in and sharing about.
Thanks so much, Megan. I also just wanted to highlight that what Megan was actually just showcasing, the KPIs, as well as the felt stigma scales and the psychosocial scales, those are supposed to be automated in Primero. So we're just working out the kinks. And so that the system will be able to add all of those different indicators to one another to be able to provide you with a score. So I haven't actually seen this in any of the programs on the CPIMS Plus side, in my experience at least, but if this is something that would be useful for your program, please do reach out, because we would love to be able to transfer this types of functionality to other implementations as well. I put in the chat the companion guide, the data visualization, and everything that Megan had just presented on. And I will open up the chat to anyone, or please take the mic if you have any questions for Megan as well. Thanks.
Yeah, and Jan, thanks. I think that's an interesting point, is that the work that's put into Primero is just beneficial across sectors, which is very cool. So I'd love to see these be taken forth.
I completely agree. Sunita, please go ahead.
Sorry, I have lots of thoughts for everybody, but thanks so much for this, Megan, and great to be connected again. So 2 points, questions maybe. Thanks so much for the presentation. One, I was wondering, within the IRC, obviously there is use of the CPIMS and CPIMS Plus, what the conversation is within the IRC on sort of integrating some of these pieces already. There's the bigger interagency piece, but we also know that very often, in terms of moving some of this, the IRC is often ahead of the game. So if there is any of that conversation around, you know, how some of these KPIs, some of the felt stigma, et cetera, could be or is already being used on the CP side, I'd be keen to hear about that. And then the second thing I was wondering if you could speak to was a little bit around, I think, perceptions of fear or concern that we hear sometimes from service providers in having KPIs and systems around how that reflects on them, and sort of then what is the right word? It's a little bit late in my day. The desire perhaps to try to have more positive inputs when maybe that's not exactly the case. That's not exactly what I'm trying to say, but perhaps you know what I mean. So yeah, I'm just wondering if you could speak to a little bit how the response has been from caseworkers, social workers, whomever as well on this in positive uptake, and sort of how they've been able to look at this positively rather than it potentially being punitive. Thanks.
Yeah, thank you so much for those questions. And I'm going to do my best to answer them all, but if I miss anything, please let me know. When it comes to pulling some of these learnings into CPIMS Plus, at least within IRC, we haven't begun that process in terms of developing KPIs for the CP module. There aren't the same outcome scales for CP that I'm aware of, but the companion guide that's shared does have a lot of useful information that's transferable to CPIMS Plus, specifically that remote supervision piece. And there's also a section on the client feedback survey, which can be used for CP services as well. So that companion guide, I think, is the starting point of pulling some of these learnings into the CP module, because there are some applicable things that could be taken forward today, though there are some development efforts needed to pull those same automated KPIs into CPIMS Plus. For the punitive KPI output piece. This is part of what I really wanted to emphasize in this conversation, is that data without context can be misinterpreted and ultimately harmful. So we have a responsibility to triangulate data and consider context when we're reporting. So that's a huge piece of this, and something, again, that companion guide really tries to take forward. So there are indices or tables that have what one singular number could mean. So a high number of reported cases could certainly mean that cases are up, that it could also mean that the organization has built trust in the community, so more people are willing to come in for services. It could mean a new site has opened up. It could mean there's an influx of people moving through the area that reflects on displacement status. And the low numbers could mean the total opposite or the exact same thing. So there's a lot of considerations we need to think about when reporting outputs. And we also try to highlight that in terms of advocacy and donor reporting as well. So that's where we're really trying to emphasize, Sunita, these pieces on the KPIs. So it's helpful and useful to get quick, aggregate, anonymous data that can be shared or used to inform programming. And we also need to emphasize context first and foremost. We had an opportunity to create some really wonderful videos. There's one about contextual clues that might be useful to share. So I'll pass that along to Jan and have those shared out as well, because it also is a nice reflection on the questions you asked.
Great, thanks so much, Megan. It is a really good point, and I think maybe just for others, and certainly something that I reflect on a lot are exactly the points that you made, and the ways in which we talk about all of this. So thanks for that.
Great, thanks so much. Any other questions from the group for Megan? Right, I just want to say thanks so much, Megan, for taking the time. It's also bright and early for Megan to join this call, and really just so excited that this is something that we're really trying to incorporate. And the fact is that we're really trying to share lessons learned between the different teams, and really to just improve our community building. As I mentioned when I first started chatting with everyone at the beginning of this meeting, was that we have child protection, and GBV is always under resourced, and we really want to make sure that we can work off of each other's work. And one of the things that I wanted to do next was to do a quick survey on really just how we're doing in terms of understanding what your needs are, and being able to collect information from you on how we can improve our data analytics in Primero and all of the various modules. And so what I'd love if you could do is if you can click on the link in the chat. I am going to do a quick survey to just get some feedback on what you saw today. And I'm going to share my screen as well. And please feel free to let us know, would you use any of the different tools that were presented? So you saw today about how we can do integrations with the ONA dashboards, as well as other interoperability with different systems. We talked about how we have insights and how we can improve the different types of variables that we're doing manipulations and pivoting on within the insights in Jordan. And we talked about the different types of scales and the companion guides and the GBV IMS Plus, and how we can incorporate those into your programs and your forms to help better inform your programming. Great. Well, that's good. It's nice to see that we're on the nose. I'm going to go to the next question. I know we have quite a bit of people on, but I will continue on as we're about 10 minutes left. What I'd really like to know is what type of data analytics would be useful for informing your programming. So as you were listening to all of these different presentations, what were your key takeaways that would be helpful for you? Would it be the data insights that Abid had shared, these different integrations with ONA, especially if you have multiple stakeholders? And feel free to be very specific with any of the types of reporting or insights that you're looking for. So we're looking at benchmarks for comparison. I think this is something that a lot of people have been reaching out about is trying to figure out how we can do trends, but also comparison data. The quality of services, the impact of services, support needed by social and caseworkers to feel more confident in doing their work. So more on the insights and Power BIs, better data visualization, more custom aggregate reports, the number of services and follow-ups per donor codes, more data visualization, and being able to do insights to do trends by region, being able to pull them from other systems and allowing for meaningful interpretation. There's more, and Power BI. Wonderful. Linking to a web dashboard. Great. We got some upvotes on some. Wonderful. So the next question I'm going to put in, it's just actually on the Power BI dashboards. This was presented, I think, in the last or the first presentation that we had for the Primero Data Challenge. And we really wanted to understand if the tools that we're building actually are helping you, creating this space where we're able to talk to one another. Everything that we talk about here, we try to pull into documentation, and something that I was sharing earlier was our data challenge microsite, which is right here. So if you haven't seen the Power BI documentation, it's here on our microsite. Really, we want to be able to, sorry, it's just embedded somewhere here on Q1. So at the top right-hand corner of the screen, you're going to be able to see the PowerPoints and the recordings, as well as some key takeaways, which you have here, which includes the Power BI integrations and how we can actually do this Power BI integration. So if you haven't done it yet, I know I can see there's a few people in this who haven't tried. It's all of the guidance is on this page. And for those of you who didn't find it easy to follow, we'd love your feedback. We want to be able to improve the way that we're doing documentation for all of these different use cases that we've talked about in today's presentations and all of the ones previously. So please feel free to reach out at any point if you do have that feedback. And very happy to also see that 5 people have been able to follow the documentation and set it up themselves. So with that said, I am going to stop sharing. We're going to take away the feedback that you've put into this Mentimeter and really appreciate this. And I'm going to hand over to Robert, yes, who's back on the call.
I was just going to say thank you, everyone. I don't have a lot more to share. My main The incentive that we included for those of you who started with us from the beginning of this idea of a data challenge was that we were going to try to generate interest. We're going to try to demystify and make data use and data visualization more accessible to more people in our community. And we're hoping, and depending on you, to communicate these things out to your communities as well. But one thing I wanted to circle back to is the promise that we were going to select a winner at the end of the year. So we're going to select a presentation, a project, a piece of work that we found inspiring, that we used, that became important for us. And we're going to do that in the global meeting in November. So right now we're still forming the agenda for that. We will, like last year, have a global webinar for people who can't join us in person in Bangkok in November. But one of the things that we would like to do is do these quick sort of summaries of these fantastic applications of data usage across our community. And then the winner will get to select a feature that they want from the backlog. So they'll be able to look at a menu of features and say, we would like this one, and therefore have attribution for within their community for getting some cool new thing for Primero on behalf of their users. So keep that in mind. It's just a fun way to keep the options and the interest alive in this. And please circulate the links and make sure that your teams and partners know what we're doing here, and the more the merrier. Thank you, everyone.
Thanks, Robert. Thank you, everyone, for your time. We'll share everything over email, and please feel free to reach out if you have any more suggestions for the next quarter's Primero Data Challenge. Hope you guys have a wonderful evening, morning, afternoon, wherever you are, and look forward to speaking with you all offline. Thanks so much.